Now I will teach about history taking in surgery. First is outline. Outline history taking. First is patient particulars. Name, age, sex, address, education, occupation, religion, date of admission, date of examination. Second is chief complaints. Chief complaints should always be written in chronological order. Example is pain in right upper half of abdomen since 2 years, yellowish discoloration of eyes and urine since 2 years. Third one is history of presenting illness. In history of presenting illness, we write patient was apparently alright 2 years back. In this case, when he or she developed, then we have to elaborate each of the chief complaint in one paragraph, and we should maintain chronological order. Now past history. Past history, we will write history of similar complaints in the past, history of diabetes, mellitus, hypertension, TB, asthma and malignancy in the past, history of medical or surgical intervention. After that, personal history, diet, appetite, sleep, bowel, bladder and habits. After that, in case of female, we write menstrual history, age of menarche, cycles, duration of period, amount of blood loss, and in postmenopausal women, mention the time of menopause. After that, obstetric history, in which we write about parity index, that is para, gravida, and abortion. Now, family history, history of similar complaints in the family, and history of diabetes, mellitus, hypertension, TB, asthma, and malignancy in the past. After that, we write treatment history and history of drug or food allergy. After that, history taking is over. Now we come to physical examination. First is general survey, in which we will write that patient is conscious, cooperative, well oriented to time, place and person. Then built, that is skeletal framework, and nourishment. Nourishment is BMI, vitals like pulse, respiratory rate, blood pressure, temperature. Then pallor, icterus, cyanosis, clubbing, lymphadenopathy and edema. Then we come to local examination of, like, if we are given the case of breast, then we will write local examination of breast, thyroid, etc. And then after local examination, we will do, like in local examination we will do inspection, palpation, percussion, auscultation of that region only. After that, we come to systemic examination of CVS, CNS, RS for abdomen. In CVS, normal, it is normal, we will write no focal neurological deficits. In CNS, we will write no focal neurological deficits. In CVS, we will write S1, S2 heard, no murmurs, S1, S2 heard normally and no murmurs heard. In RS, we will write like normal vesicular breath sounds heard bilaterally. In per abdomen, we will write soft, non-tender, no organomegaly seen. After that, as we know, summary of the case, and then provisional diagnosis, and then investigations, like investigations and treatment, which come under management, and at last, the professor will ask us about the differential diagnosis. Thus, I will quickly summarize the case. First is patient particulars, then chief complaints, then history of presenting illness, then past history, then personal history, then menstrual history, then obstetric history, then last is family history, then treatment history, history of drug or food allergy. Physical examination in general survey. General survey, like this, we will follow vitals, then this, then local examination of that region, and then systemic examination, then all these. Over. Thank you.